A new report out today shows nearly half of all children in the U.S. are breathing unhealthy air, and experts say it could get worse. The American Lung Association found 46% of kids in areas with failing air quality grades with pollution linked to asthma, lung damage, and long-term health risks. Here in the Northwest, we have seen how wildfire smoke can quickly turn air dangerous, something that researchers say is becoming more common with climate change. The report also warns rolling back environmental protections could further impact air quality, especially for children and vulnerable communities. Well, joining us tonight to help break down this new report and what it means is Dr. Vin Gupta, public health expert and senior medical analyst for MS Now. Thanks for being with us, Doctor.
Good evening, Joyce. Great to see you.
So this report says nearly half, 46% of American kids are living with unhealthy air. What stood out most to you in this report?
Well, I think that was the top line, Joyce, is that children are being disproportionately impacted. I mean, this is not sparing anybody, 150 million Americans of any age, but the fact that almost half of all children, Joyce, across the country are being exposed to ozone, which we otherwise know as smog, or particulate matter air pollution. That's what we can sometimes see, but definitely breathe in when we get exposed to, say, wildfire smoke, or if you're next to the diesel exhaust from a bus or a truck. That's air pollution. That's what we're really worried about. And what we're noticing is that the impacts on developing lungs in particular, Joyce, that's the big worry here. Young people take a lot of breaths. They're actually exposed to the environment much more, their lungs are, than adults. And this can impact size of lungs. It can impact predisposition to asthma, other chronic illnesses. So that's the concern.
So short term and long term, what is the impact for kids breathing really unhealthy air?
Well, so short term, wildfire smoke, all of us have lived this now, and especially the last 15 years here in the Pacific Northwest. That's ending up in the hospital or an ER urgent care with an asthma exacerbation if you're predisposed to it. Long term, just to take the other side of that, if you have no history of asthma, you might be at risk of developing asthma, especially if you're younger and chronically exposed to poor air, say in an urban inner city environment. We also seen the demographics here, Joyce, of air pollution work across ethnographic lines, demographic lines on age. If people of color, 2 to 3 times more likely to get exposed to poor air quality than Caucasian Americans. So there's a lot of implications here from a socioeconomic standpoint, and frankly, where just people live and breathe day to day.
And you brought up the wildfire smoke, which we experience here in the Northwest. It's not uncommon. So how much is that driving some of the pollution and some of the issues that we're seeing locally?
A significant amount. So I'd say in the Pacific Northwest, for all of our viewers here regionally, that's the big concern. It is concerning that there's no federal EPA, frankly, anymore. And I say that in tongue in cheek to some degree, but the EPA has abdicated its duty entirely, Joyce. And so that means no federal laws or accountability on tailpipe emissions, smokestacks, no federal oversight. So if states aren't intervening, there is no federal accountability. But really here in Washington state and in particular, between the summer months, say June through September, that's when things really ramp up here. So that's when we see a lot of ER visits for heart failure, asthma exacerbations. And that's when children, frankly, are really vulnerable, especially if they have asthma. Expectant moms, Joyce, we know that if they're exposed, they're more likely for preterm birth. Baby might have immune system deficiencies. So there's a lot that we're learning as we're getting more exposed to wildfire smoke and air pollution more broadly.
And the report pointed to climate change, even things like data centers contributing to the pollution. Are those factors that people should be thinking about day to day?
I think it should impact how we think about data centers, frankly, and their environmental impact. We talk a lot. You and I had this conversation about artificial intelligence yesterday, and yet the inputs and what it requires of society, and frankly, what it requires of our environment, Joyce, I don't think we talk enough about that. What are the risks for some of these new technologies on our environment? And yes, data centers, especially as they're popping up all over the place, will impact our air quality, our water quality. And the worry again is we have seen such an attenuation in federal leadership and how we talk about these issues that will anybody take it seriously from a policymaking standpoint every 4 to 8 years? Is this going to just be waxing, waning policy, and we're frankly going to end up in a worse place than we started?
Well, and then finally, for parents, what are some of the clearest warning signs that air quality is impacting their child's health?
More than anything else, I would say if it's presenting itself in children and air quality sort of implications of poor air quality, usually it's going to be in breathing because even if you can't see it, it's going to impact airways and the lungs more than anything else in children, especially because they're breathing more than adults, frankly, and they're just exposed to that poor air quality. So notice wheezing, especially in wildfire smoke season. If you're noticing, especially if your child has asthma, Joyce, peak flow monitor at home. If that to trend that, especially if you're noticing different differential peak flows from the summer months to say the winter months when there's less exposure. So there's ways to keep and just functionality. Are they able to be as active and energetic as possible, or are they lethargic and fatigued? That could also be a sign that their lungs and frankly their heart may not be functioning as properly as otherwise would.
Dr. Vin Gupta, we so appreciate your time tonight. Thanks so much.
Thank you.